Not any injection could bring your hair back. Not every patient is suitable for PRP. But yes, PRP is very effective treatment. Being in surgery and knowing anatomy, I am looking at the patient not only at their skin, but also at the movement of the muscles. Any surgical procedure is a big trauma for the body.
With so many new treatments coming out in this industry, for example, Exocet, Sculptra, polynucleotide, all these new names.
That's why we always do a one-to-one skin analysis and consultation. I had many patients coming for fillers. They're ending up with Sculptra. They're ending up with polynucleotide.
Gel nail polish, meaning getting gel nail manicures, has been banned in the EU. Today, I'm joined by someone who is truly at the forefront of aesthetics in London, Dr Vahe Clinic. With over 2 decades of medical experience, Dr Vahe isn't just another name in the industry. He's a leading plastic surgeon, a medical director, and a trusted voice shaping the future of aesthetics. He completed his medical degree in Germany at Hamburg University before earning not 1 but 2 PhDs, including one from Imperial College London, a testament to his commitment to deep medical knowledge and his surgical excellence. Alongside his work at King's College London Hospital, he runs Astrum Clinic in Knightsbridge, where he's known for combining precision with artistry to deliver natural, confidence-boosting results. Whether it's advanced surgical treatments, innovative technologies in skin and body aesthetics, or helping patients feel educated and empowered in their choices, Dr. Vahe is the kind of expert you want guiding your journey. He's not just keeping up with the industry, he's helping define it. I wanted to ask, to start, you actually originally trained as a surgeon, so tell me more about your medical journey and then how it led you into aesthetics.
But yes, so surgery is my passion, and I'm still doing surgery. But what I also noted that surgery makes big transformations. And I was thinking, okay, what if we can do something beauty links related, but without these major invasive procedures? And that led me into the aesthetics, where I found without traumatic big changes, we can achieve good, beautiful enhancements.
So you're mentioning surgical versus non-surgical. Were people opting for surgical treatments when they didn't necessarily need them then?
Yes, unfortunately, I've been seeing many patients who were looking for a facelift or any significant transformations on the face, on body, and I had to refuse them because this is not my a uh, to achieve beauty look. That's I think what I was considering to answer.
So could you have any examples of when you actually had to refuse a patient, and why did you refuse them?
Yes. For example, a couple of years ago, I had a patient in her late 30s looking for a mini facelift. But after assessing her and considering her age as well and her look, it was not indicated. So I refused her, and the patient was very unhappy. I heard that she had the procedure done by other doctor, not in the UK, in Turkey, and but I met her after probably 8 months again, and she regretted about the surgery because she did not see much difference, and yeah, she wanted another non-surgical approach
Why did she regret the surgery?
because she did see fantastic results, but those results lasted only for 2 months.
Why did they last for such a small amount of time?
He underwent through mini facelift, which is less invasive, very little improvement, and it came back to her normal within 2 months time.
So what would you have recommended that she should have done instead of the surgical facelift that she did?
We suggested her to have a skin booster treatment and collagen boosters, which would definitely give her a better lift and long-term results. For example, Sculptra, and doing Sculptra as a facelift is fantastic pre-surgical procedure which we offer to any patient who is suitable for it.
You actually said no to her to doing the facelift. What do you think her reasons and motivations were to go against what you said?
I think that's probably a social media trend, and this is what is wrong nowadays.
She lost, so she saw on social media that
She saw, she read, she was comparing herself to her older friends, and that yeah, that was not the right indication for her surgery.
do you see other similar patients like her in their mid-30s wanting facelifts?
Unfortunately, recently, yes, due to advertisement and social media, but we always discuss, assess the skin. We always consider more initially less invasive procedure rather than go under the knife.
Why would you recommend to not go under the knife?
If it's early, if there is no improvement long term that they should expect, and yeah, mostly because of the and secondly, any surgical procedure is a big trauma for the body, and before any surgical procedure, they should consider pros and cons of the treatment.
When you say trauma, is this both physically and mentally or emotionally or just physically?
Mostly physically, but also mentally. Like any surgical procedure requires some period of downtime, bandages, swellings, bruises, which not every patient could tolerate for long term. Also, risks and complications from surgeries are quite high in comparison to non-surgical procedures.
You mentioned Sculptra earlier. Sculptra is a word I've heard many times, but actually I don't know what it is, and I'm sure a lot of people don't know. But you're recommending this over a surgical procedure, so could you tell me more about Sculptra?
Sculptra, or a polylactic acid, that's the chemical name of the product, is nowadays a trend because it is allowing to own collagen. And the way we are treating the patients with Sculptra, we're also giving them this mini facelift look. Sculptra is is less invasive than any threads or any other treatments for structural changes for the face, and with a long-term results about 2 years. It is stimulating now the natural collagen production. It is giving a facelift. It is also a very natural looking treatment. So patients, they are not gone after the Sculptra. By saying Sculptra again, I mean polylactic acid. Uh, yeah, this is very popular nowadays, and this is what we advise for ladies who are looking for some improvement, some enhancement, but not surgical. This is pre-surgical procedure. And in the social media, there is an information that many surgeons are advised against Sculptra if patient is going for the facelift in the future. I can assure you that this is true only if patient is considering to have the surgery for the next year or two.
Mhm. Polylactic acid sounds like a scary word. Is this something that people should be nervous about putting in their body? And is it a natural substance?
It's a chemical substance, small particles which are stimulating collagen production of the body. Uh, Important thing, it needs to be done by a professional and trained practitioner to avoid any complications.
How has your surgical background helped you in your career in the non-surgical treatments industry?
So, being in surgery and knowing anatomy, I am looking at the patient not only at their skin, but also at the movement of the muscles, puppets, at the sinking ligaments, and only after assessing all in as a one, I am treating and trying to deliver the procedure. Because, for example, with Botox, we're just relaxing the muscle. That's easy to do, but we're not thinking what impact it will give to the patient's further movements of the forehead or around the eyes. With fillers, we can enhance cheekbones, but what will happen to the nasolabial folds? What will happen to the lower part of the face? So, its surgical knowledge allowed me to assess holistically the full face with structures. So,
Your initial career was specifically surgical, then you transitioned into more non surgical. What was the defining moment that actually made you switch?
so again, I'm still carrying on my surgical practice, but non-surgical, less invasive procedures I like because I can get enhancement of the beauty with less trauma or causing trauma to the patient.
Skin boosters are currently really, really trending. I'm hearing a lot of doctors talk about skin boosters. What is the reason?
So what I also noticed last 2 years, there is a trend for fillers. But there is an uptrend for skin boosters and collagen boosters. So we define skin booster as something which is boosting and improving the skin. I would also include collagen boosters in that group. Skin boosters are less invasive. They're giving natural look over a longer period of time without volumizing the skin or giving structural changes. Skin boosters are very safe. It could be PRP, it could be hyaluronic acid based skin boosters, it could be exosomes, it could be polynucleotides, which is also very trendy nowadays. Uh, and it gives very good natural looking skin. It improves the structure of the skin, gives back the glow of the skin, and stimulates to some extent collagen too.
People that are new to skin boosters, how would you explain the difference in results from skin boosters versus a surgical facelift?
But they are completely different. Skin booster is mostly to treat the skin and enhance the beauty of the skin. Surgical procedure is mostly structural changes like facelift, including the sagginess of the skin, which could not be addressed by the skin boosters.
So earlier we mentioned that the patient who wanted the surgical facelift, you actually recommended for her to get skin booster. So what would be the results be that she would have seen that would have helped her feel that she would have got a similar look or maybe the similar confidence that she would have got from the surgical facelift?
So the patient was unhappy with the sagginess of her skin and a hollow cheekbones area. So we suggested to have a collagen booster as a skin booster, and which would given her would pronounced cheekbones and lifted medium face, but she refused.
Do you think that a lot of people get these procedures to maybe give them a confidence boost, or it's for an insecurity, or what was the reason that she wanted this look and what was she getting from it?
I think in that particular case, it was a social media trend, but I had a patient who had a very little, very subtle, for example, lip filler, and that gave her very huge self confidence. She walked out of the treatment room with a taller smile and more confident. So just a little tweak could also give self confidence boost.
I think the idea of medical aesthetics is for the natural results, right? It's not to kind of overdo it. How would you define natural results for people?
So, firstly, by assessing the patient and also looking not only at anatomy but also proportions. And this is when people are when many patients are lacking, unfortunately. So, creating proportion, uh, considering anatomical specific structures, uh, I'm trying to deliver the treatment without giving this damp artificial look. Less filler, more skin treatment.
One of the skin treatments that's really popular right now are exosomes. I know there's loads of different types of exosomes. How do you define what they are and how they help you and which ones to know, like to use in your face?
That's a very good question. Actually, I've answered this question twice already today with my clients. So exosomes are little messengers which are telling the skin cells to rejuvenate, to renew. This is the easiest way to explain what is it. And on the market, there are different types of exosomes. I am always advising if you are going for exosomes, make sure it is a medically validated exosome. And my preference is over human exosomes because I consider human exosomes are the best messengers to deliver this message among the skin cells. There are plant-based and bovine-based or animal-based exosomes used in the market. I have used few times but without any good results. I haven't seen any results, net good results. So my preference is to use human-based exosomes, which are validated, which are produced by the manufacturer well known, which are based on scientific studies as well.
How would we know if the clinic we go to using medical grade exosomes?
So information about the exosomes should be explored to the patient prior to the treatment. With if patient requests scientific proof of it, this should be also delivered to the patient. And yeah, I think every uh, qualified professional should use a qualified product. And this is what when it's not done, then we're facing a botched work.
So, using human exosomes, is that ethical? And would I be getting it from somebody else's body or is it coming from mine?
So you can have your own exosomes re-injected uh, through a technology, removing the DNA material from your stem cells. But also, with regards to the ethical aspect, we are using polynucleotides, which are DNA-based gel for skin rejuvenation, and we're using bovine or plant-based exosomes. I would not rather consider ethical parts of human exosomes. This is something we completely cleared from DNA material, and it's just a little small messenger.
Exosomes are a fairly new treatment in this industry. How did you specifically know that this is something that works? Like you said that you prefer using human exosomes. How did you know that this works and did you do your own research?
Using the product which is widely studied and validated. I don't want to advertise any other products, but the products we are using in our clinic are qualified and studied and validated. Uh, None of the exosomes are FDA approved. So we're waiting for FDA approval as well, which might come or not in the future. But the fact that the product was validated and studied long time before they went into the market is very promising for us.
With so many new treatments coming out in this industry, for example, exosomes, Sculptra, polynucleotide, all these new names, how can patients cut through the noise and know what is really going to work for them?
So that's why we always do a one-to-one skin analysis and consultation. I had many patients coming for fillers. They're ending up with Sculptra or they're ending up with polynucleotide treatments. I had a patient a couple of days ago, she came for lip filling with a dermal filler. Looking at her lip and understanding her expectations, we decided to go for PRP for lip upper lips treatment, which she was very happy and more appreciative than having derma filler. So it all depends what is the expectation of the patient, and we are as a professionals need to uh, provide and offer the right treatment.
Could you give me an example of a time that you would opt for PRP for lips or maybe not using filler when a patient has come in for asking the filler?
So a lady in her 70s, she was super scared of having lip filler because she heard that lip filler could migrate, could cause blindness. Yes, it could, but and she didn't want to have an artificial plumpy lips. She didn't want any volume. She just wanted hydration in her lips. So there are two options that we offered her. Either go for very soft derma filler, which is giving hydration, but that's a filler, which she's scared of, or PRP, her own PRP. Thanks God, she was although in her 70s, she was very fit and well, healthy, and her blood is suitable for the PRP. So we did PRP for her lip, and she was very happy because she had the most natural treatment, safest treatment, and she will have very good results as well.
How can you convince patients that sometimes this is the better option, as filler is something that you see instant results? Things like PRP and skin boosters is kind of long lasting and you don't see results instantly. So what would be the expectations that like this woman wanted that you thought actually it would be better if she goes down that route?
We always speak to patient and listen to him and explain. The education of the patient is must between professional and the patient. Unfortunately, not everyone is educating the patient. And my main thing is that I am educating the patient. I'm explaining why with Sculptra or polylactic acid you will see results after 3 months. With filler, you will see instantly the result. The patient go for Sculptra or polylactic acid treatment because they understand what they know the truth about the treatment.
I'll tell you a story about myself. I'm 26. I had my first ever medical aesthetic treatment when I was 21. I really wanted lip filler. I wasn't insecure about my lips, but I thought I would look better with bigger lips. I didn't have any anymore, but at the time, the doctor didn't really educate me. I just said, I want bigger lips, and you'll find this funny. I said, I want 3 ml in my lips. I had no idea. I just thought 3 ml is so small. And he said, okay, we're not going to do that much. But he didn't tell me why or anything. And I think that is such a big problem in this industry that people want treatments because they want certain results, but they don't know what they're getting. How does your clinic differ in educating patients? And how do you think the industry should change to be educating patients more?
The industry must be regulated because I'm pretty sure that a qualified and professional injectors, they will definitely educate the patients prior to any treatment. Unfortunately, we have many non-trained, non-qualified practitioners, and this is when we are ending up with botched work. I'm seeing many botched work patients with complications, with filler migrations, to fix the problem. And the main problem is probably a price that they are going to those places. But if you want to have a good work done and this is your body, you should save more, probably, I would say, or don't consider it at that moment. This is my advice to every patient. I have patients that are coming to have a treatment, but it's out of their budget. This is an aesthetic treatment, so we should consider every budget, but we cannot do something dodgy or use some unproven products to deliver the treatment.
So a year ago, I actually went to a doctor. She was a doctor. and I asked her to do my masseter Botox, and also she did some Botox here as well because I thought that my mouth was downturning. Again, I went explaining what my problems were with my face. Masseter Botox was more actually for the fact that I had a teeth grinding problem. But again, I wasn't educated in what I was doing. And what actually happened was I got a frozen face. She was a medical practitioner. What are your thoughts on this? Because that kind of means that she was medically trained, she would have been regulated, but I still got a botch job.
So I would definitely have a look at the reviews. I would definitely ask for more before and after photos. Uh, this is what I would do. The the percentage of refusal, my refusal to the patient is quite high, and I had many patients that are unhappy going saying why you don't want to do. I had a lady who came with very big lips, asking for another 2-3 meals of heparin. I said, do you know that you are damaging your tissues? Do you know you already damaged your tissues? Unfortunately, I cannot offer you. So my aim is not, and this we should be every professionals, not to sell the treatment which is not indicated for the patient.
This story you mentioned of this woman with big lips, unfortunately, that's all you see on social media, like women with like big lips. And that's the kind of narrative of this industry. How do we like stop that from happening? Like to ourselves, you refuse this patient. How do we kind of encourage or maybe change the narrative to make sure that more clinics are stopping this kind of situation from happening?
I think education through social media as well, and uh, we are having among professionals discussions. Uh, Fortunately, I can see a downtrend of big lips nowadays, and this is very good and promising. And more stricter regulation, more stricter guidelines, which is unfortunately we are lacking.
As a medical practitioner, how do you feel about non-medical practitioners being able to provide these surgeries and they're not technically, if the UK had regulation, they wouldn't be allowed, right? So how do you feel about that?
So I feel about that very bad, very bad. It's unsafe, really unsafe. You've seen what's happening in the news. You've seen what happened. Safe Face is a very strong and powerful organization which we are part of, and this is what every patient should look for. Is it a GMC registered doctor or NMC registered nurse practitioner performing the procedure? Is it a regulated service, or is it a CQC or a safe face registered regulated clinic where this procedure is done? If this all ticked, then you might feel a little bit safer to go to the practitioner or that clinic. If this is missing or one of those is missing, you should consider twice.
That sounds like a lot of research that someone has to do, right? How can we maybe encourage patients that this is a safe industry if you go to the right kind of clinic? Is there a, like you said, safe face, but how else would people find out about your clinic, for example?
So I think if someone is considering or any professional, any practitioner for any clinic, they should check if the clinic is regulated or the practitioner is doctor or a registered nurse. PRP, this is widely offered procedure. We are training for PRP, other practitioners, and we know we had many applications from non-medics, and we always choose and do a selection process if we will teach them or train them, because even though PRP is the most natural treatment, it's the most dangerous treatment if there is a complications. Complications could be injecting over a bubble of hair, or the damaging nerves or damaging big vessels. But unfortunately, I've heard some barbershops offering PRP for men, which is unacceptable.
barber shops offer PRP.
Yes, many pay for it, and they go there. They go there after having haircut, doing having also PRP. And I'm always thinking when this regulation should come to be filled.
Do you think people are aware that, like you said, this isn't the most natural procedure, but it's the most dangerous too? Are people aware of this?
No, but they are recruited by the barbers, with all due respect to them as a professionals, but they are not trained to perform PRP.
How are they allowed to do this?
This is not regulated service. This is unregulated service. It's very easy to buy a centrifuge, to buy tubes, go and have a training as a phlebotomy, which costs a few hundred of pounds, and just perform the injection. They don't even know where to inject. They think scalp is just a place, for example, you can inject everywhere. No, there are nerves, there are big vessels. If you damage, you will be in trouble.
Are there any countries that do regulate PRP, or is it this is just in the UK that this is the case?
You know, in France, PRP is banned. As yes, and I know why, because there was a big complication and death after PRP, and this is not. This treatment must be regulated in the UK as well as any other aesthetic treatments.
So it was banned in France, but it's allowed in the UK. Do you think they should be banned in the UK, or
No, it should be regulated. It should be regulated. But nowadays, I think in France they lifted that ban. Only doctors, not even nurses, are allowed to perform this procedure. But something similar should be in the UK.
why do you think it's the case it's not regulated yet?
It's a business, and it's a big business, big money. Not everyone is happy to regulate it. This would be my answer.
Wow. It doesn't sound very safe. Let's talking about PRP. It is becoming quite common in a positive way that men are open to getting these kind of treatments, because usually it might be seen as like weird if men get medical aesthetic treatments. Are you seeing a trend in men coming to the clinic?
Well, yes, it's happening for the last 5 years now. Many men are coming not only for PRP but also in a discreet way for Botox treatment. Profilo is very popular among men because it's giving very good moisturizing effect to the skin. Uh, yeah, men started looking after themselves, which is very good. And PRP is the most natural treatment, especially for scalp, beard, and skin, face skin. It's performed very quick, very safe in very safe environment.
Would you say PRP is a definite results, like a treatment? By that, what I mean is my mum actually bought PRP for her scalp. The idea was she wanted to increase hair growth, but it didn't work for her. So is it a guarantee it will work?
So there are few factors that must be considered. Firstly, which technique was used by harvesting the PRP? And this is another topic, which tubes were used for to harvest PRP, because based on the social media, I can see just a simple blood testing tubes are used to harvest PRP, which will not do any work at all. Secondly, how it's been delivered. Is it a microneedling or is it an injection? Where it is injected, with which frequency it is injected, and how much it is injected. And the most important is if there is a lost hair follicle, no other treatment rather than hair transplant will help. Assessment is paramount to understand if the patient will benefit from PRP or not. Not every patient is benefiting from PRP. And this is also very important to know that not any injection could bring your hair back. Not every patient is suitable for PRP. But yes, PRP is very effective treatment if the patient is suitable for it.
What is type 4, type 5 baldness?
It's almost full baldness.
Oh, okay. Who would you recommend PRP for the hair for? What kind of people would benefit from that kind of treatment?
So nowadays we have a very good genetic hair loss test, which allows us by analyzing patient's DNA to understand if the patient is suitable or not. Unfortunately, it's a little bit pricey, but it will give us 100% answer if PRP will work or not. Many patients having PRP 5, 6, 8, 12 times without any visible results. The way we approach, we do a scalp analysis, we collect the medical history, we do blood tests, and we offer this DNA test. The patient is happy, they will perform it, and after having the results, we all offer the treatment. If patient is not going for the DNA test, by assessing the type of the hair loss, we can offer either it will help or not.
As a surgeon and aesthetic doctor, what is your favorite treatment to provide people?
I would probably say PRP, not only for hair, but also for skin, also for cellulite, also for lips, also for jaws. Because PRP is the most natural treatment.
Have you had any treatments yourself ever?
PRP,
Wow, why did you get PRP?
as I said, this is the most natural, safest treatment, and most effective. One of the most effective ones.
You mentioned PRP for joints. That doesn't really sound aesthetic, so what is that?
This is mostly for orthopedic issues, and this is our orthopedic surgeon preference. It's injection to the joints to improve the pains and to improve the joints.
So I'm 26. I've been starting to think about my collagen in my face will slowly start to stop producing so fast, right? I was then thinking of procedures I should be getting soon. What would you recommend to someone of my age?
So I would definitely start with keto. Your own blood will help you more to delay the collagen loss in the future. Once you reach your 35 and above, we might consider some collagen boosters. But PRP would be your first step to go for it.
Wow, that's so interesting because some people do recommend polynucleotides or exosomes first. What would be the reason that you don't recommend those versus PRP?
Once we inject polynucleotides or exosomes, your skin cells will understand, okay, we need to work under this protocol. I would prefer to delay that process a little bit for a couple of years before you start. And looking at your skin, I don't think you need polynucleotides at this stage.
Last year, or actually a year, 2 years ago, and I really wanted under eye filler. I didn't have anything right now, but I really, really wanted it. I thought genetically, I'm Indian, and my mom and my grandmother have quite deep under eye, dark under eye circles, and I really wanted it. And this doctor I went to, he actually said no. He refused to give it to me. I was only 24 at the time, and he recommended polynucleotides. Do you think from that point things have changed and now like maybe he would recommend PRP? And what are your thoughts on that?
No, I would add PRP to the treatment protocol as polynucleotides. Polynucleotides under the eyes are addressing two issues. A, they are improving the hollowness of the skin. B, they are improving the brightening of the skin. So, in complex with PRP, they will do their job doubled.
Do you see any difference in how women and men approach aesthetic treatments?
Yes, men they try to stay discreet and hide their treatment. Most of the women patients they are trying to show their treatment's results.
Really, I actually think there's still a stigma, no, around getting an aesthetic treatment. What do you think?
I think it's changed lately because it's very popular on the social media, and social media is unfortunately driving these trends at this moment.
What I noticed is that a lot of what we were doing some street interviews, you were asking men and women, how do you feel about your partner getting a medical aesthetic treatment? And all the men said we wouldn't want our wives to get it. And I thought that's not such a good narrative, right? It kind of saying we don't like it. Do you think that getting an aesthetic treatment indicates that women are fake or like anything like that?
No, I don't think so. And I can give you an example. I had a patient, a lady came for the lip filler, and she was asking for the lip filler. We refused to do it because she didn't need it. And she said, "Oh, they're talking like my boyfriend." I said, "Okay. And why you are saying that?" "Oh, my boyfriend was against this treatment, but I think he needs a Botox." "And how old is your boyfriend?" 29. "Okay. Do you want to bring him in?" "Oh, no, 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 no. He doesn't like aesthetic treatments." This and that. Hopefully, they will not hear this podcast. But boyfriend ended up coming discreetly from the wife or from the girlfriend and having the Botox down because it was discussed at home.
Why did he come discreetly then?
Because he was against the aesthetic procedure and he was not willing to show that he underwent this procedure. This is a case from the real life.
Why are people embarrassed to admit they've had an aesthetic procedure?
That's difficult to say. Many factors could play a role: social environment, family, uh, background.
Do you see a specific type of maybe person who is more open versus maybe a specific type of person that isn't so open in these kind of things?
It's difficult to say, to be honest. Everyone is different.
On social media, what we see as young women and men is a trend of Western beauty and Western beauty standards. I'm Indian. My face is never going to look like Bella Hadid, right? Like me trying to say make it look like Bella Hadid, it won't work. Do you have examples of young women coming and asking for things that just you can't do for them?
Yes, many unfortunately, they're bringing the photos saying, "Can you make me like her?" No, we're not a copy machine. No, and everyone is different. Anatomy is different. The skin is different. Yeah, this happens quite a lot.
What do you think we can do to change that?
Probably by advertising that everyone is individually unique and beautiful. Yes, many people they might be as embarrassed of their wrinkles, and then Botox might be the easy fix and solution. But if someone is in the 20s, 30s, and uh, looking at Angelina Jolie or someone else with big lips, for example, and they want these big lips, you should not jump and do it straight away. You should explain and educate. My first timers for lip filling, they are undergoing through a very strict process of questioning by myself because I need to understand. I always tell them, we can change your lips by using the lipstick, and that's it, without any traumatizing your tissues. If you're going through the traumatizing your tissue by saying that lip filling, then I need to be sure that this is what you are expecting and you are really different.
What kind of question would you ask them?
Well, there is a specific psychological questionnaire we developed that they're good.
Do you have any examples or you could share?
Uh, yeah, we can share, but it's a more
As whole person.
person.
Okay, fine. Um, when a new patient comes in and they are exploring treatments for the first time, would you, like you said, sometimes their reasons for coming in are different than other people. Could you give me some examples of sometimes you say no, like not just because they wouldn't physically, it doesn't suit them, but maybe like mentally they shouldn't be getting a treatment.
Yeah. For example, I had a patient who came and asking for the Sculptra treatment, and when we asked if there is a chance of pregnancy, she said yes, and we refused. There was a big scandal because she said It will not harm her or her baby, or she might not even be pregnant, but there is a chance of pregnancy. And this is medically not right to perform any aesthetic procedure if there's a chance of pregnancy or if they're planning to become pregnant. That patient, that patient hates us because we refuse. But this is the right thing we did.
That brings up the point again of why it's important to be medically regulated, right? Because, yeah, like for example, what if she was to go to a non-medical practicing clinic? Would they say yes, maybe?
They would say yes to earn money. They would inject lidocaine, which is a fatal for fetus or for pregnancy, and they would end up with a miscarriage.
Oh, wow. It's not. It's horrible. How can we encourage people, like you said, just they want to, how can we encourage people to like maybe hear more about this or really think twice? For example, what I mean by this is this is an investment as opposed to like something you get as a short-term fix. Haven't we changed the narrative? This is more of an investment than something you get once and you get a result.
I think again, regulation is the parameter to change and to bring into this field. It's very, very dangerous market nowadays, aesthetic business. And there are many clinics, many non-qualified practitioners calling themselves as a doctor, which is also shocking and misguiding, and this needs to be regulated by the better.
Do you think there is a chance of it being regulated in the next 5 years?
I hope so. I think government is trying to do something for it for the last 3 years. Hopefully, we will get to it very soon.
So I don't know if you saw in the news recently, but gel nail polish, meaning getting gel nail manicures, has been banned in the EU because of certain toxins and the exposure of UV radiation. But this has been a long time that people have been getting these nail appointments and gel nail manicures. But now it's suddenly like the EU is seeing that this is potentially dangerous. But this has been years and years and years. Why is the UK, number one, still not regulated on this, in your opinion? And how can we avoid this happening in the aesthetics industry?
As I mentioned before, aesthetic business or male business is a very big business, very big money. So not everyone is happy to regulate it. And this is my personal opinion. But I would do everything to help to regulate those services because my kids, your kids, someone else's kids will use these nail polishes or will use at some point an aesthetic treatments, and this all must be regulated.
Aesthetics is often called vanity. Somebody who wants to get an aesthetic treatment might be called vain. Would you class it more as self-care or like, is it vanity?
I see it as a self care because we all brush our teeth, we all wash our face every day. Why we cannot just look after ourselves in the long term? And I think it's a self care, and this is where when it should be also educated as a self care rather than that.
In 10 years' time, where do you see this industry headed?
I think it would be more skin booster, collagen booster, exercise types of treatments rather than fillers or Botox.
Why do you think that is?
Because this is the way we are going to, and based on probably many researchers, preventing by skin rejuvenation is better rather than filling and volumizing already deformity.
Okay, well, thank you so much.
You're welcome. Thank you.
Amazing answers. Thank you so much. Like, I really appreciate it.
Thank you very much, and you're doing very, very important job. I think education is good, and this is a part of education.
Thank you.